We're back now with a major development in a story we first reported here 3 years ago. It's about people who go to the hospital and have no idea they'll end up paying big medical bills for rehab services. It all comes down to two simple words in the fine print. Today, a new law written in response to our reporting went into effect. Our national correspondent Kate Snow tells us more.
This is for the internet.
3 years after breaking her leg, MJ Briku is struggling financially and still feels taken advantage of.
I was mugged. I think that's an appropriate word to use, you know?
Good. MJ was stuck with $28,000 in rehab bills that Medicare would not cover. Why? When she went to the hospital, her doctor categorized her as being under observation. Her chart did not call her an inpatient, even though she was in the hospital for 3 days.
I just wish that they would do something to make it fairer for the people like myself that got caught in this.
For the 55 million Americans with Medicare, nursing facility rehab services are covered only if the patient receives hospital care as an inpatient for 3 consecutive days. Even more frustrating, patients have not always been told whether they're considered inpatient or under observation. That changes as of today, says patient advocate Judy Stein. What changes now?
For the first time, the federal government is mandating, requiring all hospitals to tell people if they're in outpatient observation status.
That means verbal and written notification, but there is still a catch. So a doctor could now tell you, Kate, you're under observation status, but can you do anything about it?
All you can do is complain and urge them to change that.
To fight back, she recommends ask if you'll need rehab, make your case while you're still in the hospital, talk to the hospital doctor, the discharge office, even enlist the help of your personal physician. MJ is now dependent on Medicaid, unsure if she'll ever get out of debt.
I don't buy anything personally for myself. Basically, I just pay off my bills and try to pay off my debt.
Patient advocates say there's still a lot more to be done, and members of Congress are pursuing more action to address this head on. But Lester, at least people will now know when they may need to fight being under observation
This is important information. We'll all look at the paperwork. Thank you, Kate.